Yet another in an endless series of Puscasts. This one is covering the last 2 weeks of December in the year 2017. I suspect this is going to be a somewhat quick Puscast. It was one of those periods where there wasn't a lot to find on the interwebs. References are available as always at edgydoc.com. Otherwise, let's move on to the literature, shall we? Currently, Nipah virus is not much of a problem in the United States. Why? Well, the main way you get Nipah virus is drinking raw date palm sap that is contaminated with the poop of fruit bats and human-to-human transmission. So it's conceivable that somebody from Bangladesh could bring Nipah virus to the United States. However, human-to-human transmission does occur from close contacts. And the question would be, does this exist on hospital surfaces? And the answer is yes. When the environment was examined for Nipah virus RNA, they found it in 5 of 6 swab specimens of patients in the hospital. So part of the risks of Nipah virus could very well be transmission from hospital surfaces. And they also found in this study that patients who had Nipah virus in their oral secretions were more likely to die. New Year's Eve is upon us, so I would recommend that one drink champagne instead of raw date palm sap contaminated with fruit bat poop. Although that would be better than Coors Light, I suppose, at least as far as taste goes. But otherwise, this is more an infection control issue should a patient with Nipah virus end up in the United States, or there's actually somebody in Bangladesh who listens to this Puscast. I wouldn't be surprised. One of the unanticipated consequences of the Ebola virus outbreak in Guinea was an increase in polio cases. As a result of resources being spent on Ebola control, they had a decline in vaccinations for vaccine-preventable illness. As a result, there were 6 polio patients, and there were also 7 healthy contacts that had polio virus in their stool. And what was interesting is that this was a vaccine-derived polio virus. Once oral polio vaccination started up again, the number of cases of polio declined. Yet another example of the need for herd immunity and the importance of keeping your populations vaccinated against, vaccine-preventable illnesses. One of the arguments against the HPV virus vaccine is that it will make young women more promiscuous because they're no longer afraid of getting infections. Yeah, right. As if there's ever been a teenager in the history of the planet that uses rational thought when it comes to sex, drugs, rock and roll, and driving. I can't imagine there'd be a single teenager on the planet who would say, oh, good, I've had the HPV vaccine, now it's safe to go out and have sex. And then go have unsafe sex. And it turns out in this study that having the HPV vaccine had no effect whatsoever on when young teenagers first had sex. And it didn't matter whether the patients were sexually experienced or not, getting the HPV vaccine did not increase risky sexual behavior. People just don't need to be vaccinated or unvaccinated to behave stupidly. That's the human condition. Every once in a while, I get a consult from someone who has diarrhea and a biopsy shows CMV colitis. I have long wondered if CMV colitis is more common than we suspect in normal people, but we just don't bother doing the diagnostic test, i.e. colonoscopy, in most people with diarrhea. This study out of China looked at the clinical characteristics of CMV colitis, and what was interesting in this study is they looked at 69 patients, 42 of whom were immunocompetent, and they had a 25% mortality rate. That they had CMV colitis in normal people did not surprise me. What did surprise me was the mortality rate in this study. The smattering that I've taken care of have done fine, thank you very much. Now, the immunocompetent patients did have a hodgepodge of underlying medical problems, such as diabetes, liver cirrhosis, renal failure, ICU admission. So one could argue they weren't normal. They just weren't immunocompetent in the classic sense of the word. And they also noted that early diagnosis and treatment was associated with better outcomes. But I suppose the take-home from this study is CMV colitis may be more common than we suspect. And as long as we're on the topic of CMV, there is a new drug coming down the pike. It's called letermovir, Letermovir. There was a New England Journal study that showed that it is beneficial for the prophylaxis of CMV in bone marrow transplant patients. How does this drug work? Well, to quote the article, it inhibits CMV replication by binding to components of the terminase complex, UL51, UL56, or both. And I did not know this until today, the CMV terminase complex is involved in the packaging of the genome into preformed virus capsids. So it's a drug that does not mess with DNA. It looks like the drug was approved last month for this indication. And according to one reference I found, it's going to cost $195 a tablet. Side effects appear minimal. It would certainly be nice to have a drug that was not marrow suppressive for the treatment of CMV. If I ever got a kidney transplant, I would want to be on CMV prophylaxis for life. But the current drugs are both too toxic and expensive. Now we'll just have one that's too expensive. I just can't wait till America is great again and I don't have to worry about the cost of medical care. Flu season continues apace. There's also, as you may or may not know, a cat flu, and that is H7N2. There was an outbreak in cat shelters or animal shelters in New York City, and one human, a veterinarian, got infected and symptomatic with cat flu. So as I think I mentioned before, if your cat is coughing, it may be more than a hairball trying to come up. Fortunately, H7 influenzas have a low propensity for infecting human beings, so we're safe from our coughing cats by and large for now. Of course, you need to worry more about human flu, and for that, we have a vaccine. One of the things that people have worried about is giving the flu vaccine to those with egg allergies. The current guidelines by the allergy folks say, nope, egg allergy, not an issue. And they're remarkably non-wishy-washy for a guideline. Quote, all patients with egg allergy of any severity, including anaphylaxis, should receive flu vaccine annually using any age-approved brand of flu vaccine in age-appropriate doses. Such patients can receive the vaccine as a single dose without prior vaccine skin testing. This is based upon an extensive review of the literature, which, of course, backs up their recommendations. Egg allergy is a non-starter as a reason for not receiving the flu vaccine. It's safe. Although whether you can safely give it to your cat, I don't know. And one of those interesting epidemiologic studies shows that scarlet fever, something I think I've maybe seen one case of in my career, has been increasing in South Korea and throughout Asia since about 2011. There's a nice graph with the article that showed that in 2011 there was essentially none, and they've gotten as high as 15,533 cases of scarlet fever. Rhett would be appalled. Although they suggest in the article it's not due to new cases, but due to new reporting and more insurance. As I remember, there was a study that showed probiotics was a good preventative for sore throat. This study looked to see if probiotics and or xylitol gum could treat sore throat, and it didn't do diddly. So as a therapeutic intervention, probiotics have no use in sore throats. My personal treatment for my own sore throats is 3 fingers of a good whiskey. Whether it works or not, I don't care. In 2020, the Summer Olympics are going to be held in Tokyo. So what can you do to prepare? Well, it looks like syphilis infections are increasing markedly in Japan right now, and predominantly in men who have sex with women and women who have sex with men. It would be interesting to figure out why, which they have not yet done, because syphilis as a rule tends to be a disease of the young and a disease that you see increasing when there's industrialization, such as happened in China. Why an older, more sedate population like Japan is seeing an uptick in syphilis would be interesting to figure out. But don't forget your condoms when you go to Tokyo in 2020. As a rule, humans get plague from rats, but rats are not the normal zoonotic source. In the United States, it tends to be ground-burrowing rodents that carry plague, and the same occurs in Asia. There was an outbreak of plague in Madagascar in the 1990s, and there was an evaluation of the source of this outbreak. And it wasn't prairie dogs and their kin, like you see in Asia and the United States, but the source is the shrew. Ooh. Specifically the Asian house shrew, Suncus muranus, which I'm sure I mispronounced. But it is the Asian house shrew that is the zoonotic source in Madagascar. It then moves to rats, and then from rats to humans. Rats and humans tend to die from plague, where shrews and prairie dogs do not. And as the population of Asian house shrew has declined, so has the spread of plague in Madagascar. So it's safe to say that Petruchio knew what he was doing when he was trying to get Kate under control. He was trying not only to get a good wife, but to prevent plague in his community. So he's actually a very nice guy that way. The more things change, the more they stay the same. This study looked at the efficacy of rifampin in Staph aureus bacteremia compared to placebo when added to standard therapy, be it penicillin or vancomycin, and found that adding rifampin did nothing in terms of mortality. It did nothing in terms of failure of therapy. So another nail in the coffin of rifampin for staph infections. My take is that the only time you give rifampin for staph infections is when you're treating prosthetic material. But otherwise, it doesn't add anything but potential toxicities. And drug-drug interactions are a son of a bitch with rifampin. The name of the trial in the Lancet was the adjunctive rifampicin for Staph aureus bacteremia. Somehow they came up with ARREST as the acronym. Quite the stretch. If I ever did a clinical study, I'd somehow come up with an acronym for my trial, like Butthead or something equally childish. There is more Sturm und Drang over the treatment of soft tissue infections than probably any other infection. And people do all sorts of weird things like combination antibiotics, or they treat classic erysipelas with clindamycin and Bactrim and other weird-ass things. Generally speaking, you have diffuse cellulitis, they need a beta-lactam. It's usually group A strep or another strep. If they have impetigo, purulent cellulitis, or an abscess or wound infection, those are the times you worry about MRSA. And under those circumstances, you need to give single therapy. And this study shows that sulfamethoxazole trimethoprim, cotrimoxazole, is just peachy keen as monotherapy. They went back and looked at all the clinical trials that evaluated the use of Bactrim, as I like to call it because it's shorter, in the treatment of soft tissue infections, and found it worked just fine, thank you very much. It's long been debated as to whether or not streptococcal infections can be treated with sulfa. I think the answer is yes in most cases. But really, all most people need, as I say, for soft tissue infections is monotherapy with a beta-lactam. Unless they have purulent cellulitis or abscess, then they have MRSA, and then Bactrim works, especially if you breed the abscess. People always worry about MRSA when it's simply not there. MRSA, along with Pseudomonas, is the modern medical equivalent of being possessed by demons, and people worry about them all the time, but they don't exist. Really, demons don't exist, and neither does MRSA in non-purulent soft tissue infection. Shh, it's a secret. My time over at Science-Based Medicine taught me, among other things, that p-values are not significant, unless they're at least 0.005. The 0.05 is garbage, and it means it's not a significant result. I mentioned this as there's a study that compared IV versus nebulized amikacin in the treatment of nosocomial pneumonia in post-cardiac surgery patients. And they found that patients who had the aerosolized amikacin got better faster than those that got the IV amikacin. Doesn't surprise me, as IV amikacin is probably useless in the treatment of pneumonias. Levels in the lung are negligible, and amikacin doesn't work well in pus anyway. I always figure that aminoglycosides for pneumonia are basically a expensive and toxic placebo. So I guess it's not really a placebo because it actually does something, just not for pneumonia. And they suggested that patients got better faster if they were on nebulized amikacin. But when you look at the p-values, pretty unimpressive. For fewer mechanical days, it was 0.35. For ICU stays, it was 0.01. They did not have a placebo control, which they really needed. And while I can see that maybe inhaled amikacin would be a benefit, adding aminoglycosides to nosocomial pneumonias is by and large a waste of time and money, I think. That only adds toxicity. So if you come across this study, don't believe it. The p-values aren't good and the design of the study is less than impressive. Hear that faintly in the background? That's my children and their friends watching the Lakers-Rockets game. If you hear more of it, well, I can't do much about it. They're having fun. Couple of things from the colon, or the GI tract at least. One, they're now up to 1 million cases of cholera in Yemen. Good God, that's awful. Second was a case of someone who had Campylobacter in their colon with colonization for 16 years, which is pretty impressive. I once saw a patient who I thought had Campylobacter for a couple of months, but 16 years is pretty impressive. They say, quote, the patient was consistently colonized with organisms from a Campylobacter population that adapted to the internal environment of the patient. If the key rule of real estate is location, 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 Campylobacter's got it pretty bad. And finally, an outbreak of salmonella associated with rattlesnake pills. I saw this as a fellow in LA many years ago. There was an outbreak in the Hispanic population of salmonella in cancer patients who took rattlesnake pills. You take whole rattlesnakes, you grind them up uncooked, and give them to people as a cure for cancer and AIDS. If you consider death from salmonella to be a cure for cancer and AIDS, yeah, it works. Otherwise, remember that salmonella and reptiles go together like peanut butter and jelly, and not unsurprisingly, this poor person in Kansas took rattlesnake pills that he purchased in Mexico. Take home, don't take rattlesnake pills. And while I'm at it, might I suggest you avoid armadillos? A Canadian went down to Florida and while there came in contact with Mycobacterium leprae and came back with leprosy. The isolate was identified as the armadillo-associated genotype. Although the patient in question does not remember having had any contact with armadillos or other animals or other sources of leprosy when he was in Florida. They suggest that in this case it might have been due to contact with soil or perhaps an animal other than an armadillo, pointing out that the Eurasian red squirrels that are found in the British Isles also carry leprosy, which is a real bummer because I love red squirrel sushi. But be careful when you're traveling in the American Southeast, which there is leprosy, not only in armadillos, but perhaps the environment as well. So you're leery about Japan because of syphilis. Yemen's off your travel list because of cholera. And Madagascar has plague. So where are you going to go on vacation this year? How about southeastern Australia? Well, just so you know, Mycobacterium ulcerans, also known as Buruli ulcer, has been increasing in southeastern Australia and is spreading around the area. And not only is M. ulcerans increasing in cases, it's also increasing in severity. So maybe I'll just stay in Oregon this year. And I think with that, we'll bring it to a close. The Puscast covering the last 2 weeks of December in the year 2017. I'm actually doing this on New Year's Eve. I'm on call this weekend, so I can't go out. And who wants to go out New Year's Eve anyway? So I'm sober on New Year's Eve doing a podcast. How do you spell nerd? M-A-R-K. So, references are available online, as always, and thank you for this most interesting consultation and allowing me to participate in the care of this most difficult and challenging case. I shall see you in 2018. Thanks for listening. Bye.